What causes women to develop urinary incontinence? How can you influence this process? What are the methods of prevention? Watch the video to the end to understand these questions. Before you start watching, click on the red button, then the next videos of our channel will remind you of themselves. In the menopausal period and in women over 60 years of age, approximately 30% of cases developed uncontrolled urination. What causes leads to the development of urinary incontinence in women? Depending on what type of involuntary urination is noted, the causes may be different. There are three types of this pathology. Stress incontinence, which is caused by the displacement of organs inside the body, and in connection with this, the appearance of weakness of the sphincters. The release of urine occurs when coughing, sneezing, during physical exertion. The cause of disorders occurring in the body are heavy labor, prolonged intense physical exertion, repeated gynecological operations. The hormonal background that has changed after the end of childbearing age also has an effect. The amount of estrogens decreases, and the elasticity of the bladder decreases. Urgent incontinence. This is incontinence when it is impossible to tolerate, that is, as soon as the brain has given the command to visit the toilet. It is necessary to urgently perform, otherwise there will be trouble. The cause of this condition is diseases of the spinal cord, neurological disorders, inflammatory processes in the urinary organs. Mixed incontinence, in which both causes, both displacement of organs and inflammation, are present in varying degrees of severity. How can you influence this process? To reduce the symptoms of urinary incontinence, medications are prescribed. Special exercises are performed that straighten the pelvic floor muscles, and folk remedies are used. Medications are used to relax the muscle wall of the bladder. If necessary, hormones, anti-inflammatory and antibacterial agents are used. It happens that surgical treatment is performed. From folk remedies, decoctions of medicinal herbs help to cope with the problem. To prepare them, dry or fresh plants are used, which are brewed and infused in a thermos. The usual concentration of infusion is a tablespoon of raw materials per 500 ml of boiling water, and ceased for several hours. After preparing a vegetable drink, strain it and take 100 ml 3 times a day, or prepare and apply it as prescribed by the attending physician. Of the herbs most often used, dill and blueberry leaves, plantain and Ivan tea, St. John's wort and yarrow, cranberries and bay leaves. In addition to using herbal medicine, you must follow some rules. Do not smoke and minimize alcohol intake. Try to clean your intestines regularly. Perform daily Kegel exercises, special exercises for the pelvic floor muscles. To correct the diet, reduce the number of foods and dishes that provoke urination, such as carbonated drinks, coffee, fatty and fried dishes, salties and spices. Try to reduce your body weight if you have extra pounds. Include vegetables and fruits, foods rich in vegetable fats and fiber. Conduct bladder training by delaying toilet visits, starting with a few minutes and gradually increasing this time. What are the methods of prevention? As they say, you should prepare for old age from a young age. Timely and correct treatment of diseases in gynecology and urinary tract. Avoid weight gain. Eat without eating harmful and irritating foods, but using a large amount of vegetables and fruits. Try not to overwork yourself physically and not to carry heavy loads. Do not abuse alcohol and coffee. Exercise regularly, move more. Avoid intestinal disorders. Perform exercises that straighten the pelvic muscle fibers. Do not be discouraged if unexpected symptoms appear. You need to take the fight for their elimination into your own hands. Folk recommendations and home remedies will always help you do this. But first, you should visit a gynecologist.